So I'm going to be talking to you a little bit today about a project that we had in Rwanda and Uganda with 4 faith-based organizations to strengthen their family planning programs. But first, I'd just like to start off with a little quiz. So I'm going to go ahead and ask you guys what proportion, or what percentage, I should say, of health services in Uganda do you think are provided by faith-based organizations? And just go ahead and call it out. 62. Okay, you guys are generous. Okay, 47? 40?
60.
Okay. How about Rwanda? Do you think higher, lower?
Lower.
Interesting. Okay. So in reality, we have 25% being provided by faith-based organizations in Uganda and 30 in Rwanda, which is still a very significant proportion of health services. And you see this a lot in Africa, where church-based health facilities are filling in the gaps where the Ministry of Health is not covering. And it's often in areas that are hard to reach, rural areas. But what I have in the blue graph here is some data from the demographic and health surveys about sort of point of service for family planning use. So you see that only 6% of users are getting their family planning from a faith-based health organization, where we actually see that faith-based health services are a much more significant proportion than 6%. So what is the disconnect here? Is it because faith-based organizations are against family planning? What are we seeing going on here? And what we have found in our experience is that it's not because of a blanket disapproval of family planning, but has much more to do with a lack of capacity building and the resources to be able to provide those services. So what I really hope to demonstrate by this presentation is that faith-based partners are capable of providing family planning, and we can get there through a couple different steps. So the partners that we worked with in this particular project, and I guess I should say in the program, it says that this is a Catholic-focused presentation, but I hope that you'll give me the liberty to sprinkle in a little Protestant experience as well. So in Rwanda, we worked with Caritas Rwanda, which actually is a collaborating organization. They're an umbrella organization of about 30% of the health facilities in Rwanda. So Caritas oversees all of those facilities, from hospitals all the way down to smaller health outposts. And then Action Familiale Rwandaise, for any of you who were at the plenary yesterday, some of this might look familiar, is a community-based organization also affiliated with the Catholic Church that provides natural family planning and couple strengthening counseling in their communities. Then in Uganda, we have the Uganda Protestant Medical Bureau and Catholic Relief Services with their partner, Uganda Catholic Medical Bureau. And both UPMB and UCMB are similar to Caritas in the sense that they're kind of a coordinating body for church-based health facilities across the country. The approach that we took with these partners to strengthen their family planning programs was one of capacity building, so looking at the different programmatic elements like training, data collection, supportive supervision, and creating a supportive environment around the program. And we also looked at demand generation and did things like create radio spots, printed materials, and then community health talks like you can see in this picture here. And then we also looked at trying to expand access to family planning. That included integrating new methods of family planning into the programs, like fertility awareness methods when they didn't exist before. And then we really focused a lot on training religious leaders. So this idea of stakeholder collaboration, and not just with religious leaders, but also with the Ministry of Health and other family planning technical partners in that country. So we learned a couple lessons from this experience, and the first one is that involving FBOs in FP service delivery does increase uptake. So I've got a couple data slides for you. The project started in 2014, so you can see in the light purple, these are 2013 service statistics from the facilities that we worked with in terms of family planning uptake. So these are new users to family planning. And you can see that over the course of the project, the blue is year 1 and purple is year 2, but purple is actually only 9 months worth of data, so keep that in mind when looking at the progress. You can see incredible gains in new users of family planning. just want to point out, in particular, UCMB basically had no operational family planning program at all when we came in there. There were maybe a handful of nuns trained in the Billings ovulation method, but there was no strategic plan as to how family planning was being offered within these facilities. And then I can also point out AFR looks a bit smaller than the others, but just remembering that that's actually a community-based organization. There are no health facilities whatsoever associated with them, and they also had only about 40 providers active, whereas the others had a couple hundred. You can see that that progress is actually much more impressive than it might look compared to the other three. For anyone who's particularly curious about UPMB, which was the organization that does provide a broad range of methods, I just wanted to give a breakdown here. And you can see that all method use went up in year one, except maybe the permanent methods, which kind of were staying around the same. And then we also see that for the methods that community health workers were able to provide, which is basically pills, SDM, LAM, and 2-day method, we see very large increases even over year two, which is only, again, 9 months worth of data. Something that you might notice, and I just want to point it out now, is that implants and IUD, the purple you see, has gone down, and that might be a red flag in some people's mind. And I just want to say that there are other partners who do offer assistance with long-acting methods in Uganda, and in year two, that partnership ended, and so that's kind of why you see a dip in some of those methods. And then for my last data slide, I just wanted to also show the difference between the uptake at the community level and at the facility level. So for all of these partners other than AFR, community-based services were brand new. They had never before provided family planning at the community level. And so you can see in many instances, half of the users are coming from community-based services, which is really essential, especially for accessing men and involving them in the decisions. So the second lesson is that FBOs can meaningfully engage men in family planning. And we had two really amazing examples of this. One was with Action Familiale Rwandaise, which I talked a little bit about yesterday, so I won't focus on that. But the other one was through Catholic Relief Services and their partner, UCMB. And so they used a curriculum called the Faithful House. How many of you have heard about the Faithful House before? A couple of people? Okay. So this is a curriculum that CRS has been using in other health areas like HIV, gender-based violence, and maternal and child health. And this was the first time this curriculum has been adapted to be used with family planning. And so the Faithful House is really a couple strengthening tool. It takes this idea of a house, it's like a metaphor, and you go through each chapter and talk about the walls and the foundation and the roof, and it relates it to different aspects of a couple's relationship. And so they would recruit couples to come into this workshop and really focus on a lot of that marital strengthening, couple communication, and shared decision making, and also offer family planning at the same time. The third lesson is that religious leaders are willing and able to support FP, and I think that this has just been the resounding message among all the different presentations that we've heard today and over the past day or two. And I won't get into it too much because, again, I talked a little bit about it yesterday, but really UPMB and AFR did a lot to reach out to religious leaders in their catchment areas and even developed resource guides for priests and other religious leaders and lay leaders to be able to initiate discussions around family planning. And so the red one has actually already been printed, and hopefully y'all picked up a copy, but it's also available online. And then the blue one here is the one being developed for a Catholic setting in Rwanda. So the fourth lesson is that FBOs can work successfully with the Ministry of Health and other FP partners. So we saw a lot of progress in Uganda related to this, especially with UCMB, which was brand new to family planning, and they were just sort of finding their voice in this area. And because of their involvement in things like the Family Planning Technical Working Group with the ministry, we saw a lot of spontaneous requests actually for support. So the ministry requested UCMB to be part of developing a new training module for fertility awareness methods in the revised national training curriculum. And they also were asking for support in training providers, as well as another USAID funded project called the Assist Project, requested support. So we really saw a very positive reception of FBOs into the family planning decision making and just allowing them to have a seat at the table. So I do want to mention a couple challenges. The first challenge is really this idea of integration into the national level program. So a lot of faith-based organizations are kind of just providing family planning in a one-off, or they don't really have a strategic vision or plan, and they're not liaising well with the ministry. And so therefore their work is not being reflected in national statistics, and we aren't seeing the contribution that they're really making. And so we've done a lot of work to really try to strengthen that collaboration with the ministry, and a lot of it is around data reporting and data collection and commodities. And that still remains a struggle that needs to be addressed. Another challenge was maintaining sensitivity to FBO approaches, especially in things around language and messaging. So this really requires a lot of patience and attentiveness. And I, again, mentioned it a little bit yesterday, but just want to reinforce that oftentimes we see, or some people will see, faith-based organizations as the barrier or as the problem and just assume that there's no movement to be made and that there's no willingness. And in fact, there is a lot of willingness. Sometimes it's just really around capacity building, but oftentimes there's a latitude or an evolution that there's there to be had. You just have to be patient and open-minded and willing to work in that sort of slow and together two-step process. Then the last one is around countering ongoing bias against FAM. So we've really seen that fertility awareness methods have allowed some faith-based organizations to come into the family planning program and be able to contribute to those national goals. But we also still see a lot of challenges related to bias around whether or not fertility awareness methods are effective or actually contribute to program strength, or whether women even want them. And so just encouraging you all to look at the evidence and to work with these faith-based organizations to help bring them into the fold if this is the way that they're able to do that. So looking forward, just want to mention that we are able to expand this project. We're going to be working with the same 4 organizations and going to have new sites. We're going to strengthen our collaboration with religious leaders and other family planning stakeholders, and focus a lot more on trying to improve the integration of Catholic facilities into that wider family planning strategy in their local contexts. And then also just wanted to mention how we see that these findings can be used. The first one is really that we can implement this model with other Christian health associations. I know every time I go to conferences like this, I have lots of people coming up to me and asking if we work in that country, and it really is a lot dictated by the donor priority, but just to know that I continue to advocate for opportunities to do this, and I encourage all of you in that place or position of writing proposals and whatnot to be also advocating for that. Also investing in research to understand the connection between religion and social norms. I knew a little bit about your research, and I'm really excited to see that it's going to continue, because I think that evidence is very crucial. And then finally, to develop a family planning hub with the Joint Learning Initiative. So if any of you don't know about the Joint Learning Initiative, it's an online platform for resources, for evidence, for tools around just best practices with the faith community. And there is no hub yet for family planning or HTSP, and it would be amazing if we could really rally together and get that started. Thanks.